I'm with the Shape of Behavior. We're a behavioral health clinic, and we serve children with autism and other developmental delays, including Down syndrome. We use applied behavior analysis, and we provide in-clinic treatment as well as in-home and school shadowing. And this is our PCBAD, actually, for the North Hollywood clinic. I manage that clinic, and she's our clinical psychologist on staff, Dr. Paula Santos.
So today we're going to talk about toilet training. This is kind of the outline of what we're going to talk about today. Signs that your child is ready to be toilet trained, some toilet training challenges, and their overall what skills you're working on to see if they're ready, how to get started, the method that we kind of recommend at the Shape, some pitfalls to avoid, and then specifically talking about training for bowel movements. I'm going to spend a little bit more time talking about kind of the challenges and readiness. Most of the time when people come to these sorts of presentation, it's because you've already tried something and perhaps that didn't work. So just telling you to bring your child to the bathroom and put them in underwear and whatnot often isn't the most helpful information to hear if you're sitting here in front of us. So how many here have already attempted to toilet train? Okay, good. All right, see? So, and you all have boys, is that right? Okay, good. Well, let's talk first about some of the challenges when we work with individuals with special needs to toilet train. So a lot of times it's like, you might have another child in the home, and what you tried, what worked for that child isn't working for this child, or even if that child's younger, that child's already toilet trained, and your child with special needs isn't. So you've already tried some things, and like, why is it that, this one's not toilet trained, but the others are? So a lot of times there may be physical or medical reasons for having toileting difficulties. So it's always recommended that, when you go for some of your wellness checks or your checkups with your pediatrician or whatnot, to mention that they aren't toilet trained yet. There are lots of pediatricians who will say, oh, they have special needs, that's why they're not toilet trained. But, explaining like whether or not you think your child, is showing signs or not showing signs. So like if they're at an age where, that most children like, they want the diaper off when they're wet and your child doesn't seem to care. Do they not feel that sensation? Are they getting terrible rashes? And that's part of the reason. So definitely check in with your pediatrician. We always recommend that before you start a lot of treatments or whatever. That it's always good to just check in and see what's going on. The other thing is motor skills. So some of the clients we work with, they might not be fully mobile or might not have the physical skills to get themselves up and onto the toilet, and as well as to manipulate their clothing or whatnot. So those are all challenges. If you're feeling the sensation and need to go, but then you can't get yourself there, that's difficult. As well as if you can't communicate. So the language, both your receptive and expressive language, also can serve as a challenge when it comes to toilet training. So if you're not verbal, you don't have the verbal skills to express that you need to use the restroom, or you don't have the receptive understanding of what the whole process is. There are some children that you can say like, okay, when you need to go pee pee goes in the potty, and they get that A plus B equals, like get that connection. And if you do, then I'll give you a sticker or whatnot. But a lot of times the children we work with might not have that cognitive understanding yet. Overall, delays in self-help skills such as dressing, hand washing, or whatnot present barriers to the toilet training process. And socially, there's a lot socially that usually goes on with toilet training. A lot of times children are motivated to use the toilet because they want to, be like somebody else. Like, you can say, look, mommy uses the toilet, and look, I get to wear these pretty panties, or I guess if you all have boys, like, look, dad wears toilet, underwear, he gets to wear his underoos with Spider-Man, You're trying to make it sound like it's something fun and that they're going to be a big boy, and that's something that you think they really want to be. But if socially they're not at that maturity level, like being a big boy and wearing Spider-Man underwear, might not be very reinforcing or rewarding to them. They might not really care. Like, so I'm going to be a big boy. Like, they don't get that connection. And kind of understanding the social norms. Like, we work with a lot of children sometimes where, typical children, at the age of 9 or 10 or whatnot, if you're not toilet trained, it's not cool, right? So like you don't want to be the stinky kid, you don't want to be the kid with the big bulging bum, that sort of thing. But if you're working with a child that doesn't have that social awareness, it's hard to motivate them socially to become toilet trained. Like those aren't factors that they really consider. There's also a lot of fears related to toilet training, and with that a lot of control issues. So fear of sitting on the toilet, that they're going to fall in or get wet, or that something's going to come up and bite them in the bum, whatever it might be. Fear of flushing, the noise it makes. Sometimes there's a lot of other sensory stuff going on in the bathroom. A lot of times like ceiling fans, like they make those loud noises, those sorts of things. So the bathroom isn't always a pleasant place for somebody to be. As well as some of the control issues, like if they're used to things being a certain way and routine is important to them or something they cling to, when you then want to change the way things are going, there's a lot of resistance to that. Like, this is I wear diapers, mom changed my diapers, this is what happens, instead of some brand new routine of taking to the toilet, okay? So with that, there's a lot of interfering behaviors that might come up. When they're resisting when they're demonstrating those fears, like tantruming and whatnot, as well as when they're resisting that control issue, that some interfering behaviors that might come up that oftentimes even in the school where you're anticipating they're taking them to the toilet, they might be resisting taking them because the child's, engaging in behavior. So while you might think your child's getting taken to the toilet with the rest of the class, like it's not uncommon that I go into schools and like, okay, let me see how the toileting is going. So they're like, okay, let's go to the toilet, and little Johnny falls on the floor, and everyone's like, see, he doesn't go. So nobody brings him to the toilet, and he gets out of it. So he doesn't ever really go to the toilet at school. So these are some of the common challenges. Any of you experiencing any of these?
Definitely
the motor skills,
like taking off his
clothes,
the cleaning. I mean, he pretends he's
cleaning. Okay.
But
The whole motor skill. Okay.
My son holds it the whole time he's at school.
Okay. So maybe a control thing, that toileting happens at home. I think, especially sitting in a room full of women, that you can oftentimes, like, you don't like to use certain restrooms, and I know that, like, I don't like to use public restrooms, and there's a comfort of being at home and whatnot. So your child might also be experiencing that same thing. So exposing them, to other restrooms and rewarding them or whatnot might be something good. But if he's not going to the bathroom, is he peeing at school, or is just neither one? He'll sit. Okay.
Yeah, he'll sit nicely.
Okay.
Yeah. They take him twice a day. He's only there 2 hours and 15 minutes.
Oh, okay.
Yeah, he'll sit. And
He'll
he's
sit.
Fine, but
He won't go.
No, and he comes home, I'd say 90% of the time dry.
Oh, okay. What if you like flooded him with water or some fluids at school? He would pee in his pull-up. Okay. So some of the signs that your child might be ready for toilet training is oftentimes the developmental age. So it differs for boys and girls. It's not too drastic, but girls are generally toilet trained earlier than boys. I think we all know that. And that has to do with a lot of that social maturity issue. But a lot of times with children with special needs, that part of the equation is often removed. It's usually on average between 18 and 30 months for girls, with the average child trained at 29 months, and for a boy it's at 31 months. So, and it says that by the age of 3, 98% of children are toilet trained. So who here?
Typical kids or special?
Typical.
Oh.
So who here has a child over the age of 3? Okay, so you're in that 2%. Look at your odds of winning this are much greater than. Okay, so one of the things is showing signs. So is your child showing signs that they need to go to the bathroom or they've gone to the bathroom? So a lot of times children, when they need to go, like we'll see kids that are needing to poop, they'll like go and hide in a corner or squat somewhere or take themselves to their special place behind the sofa or something. So they're preparing themselves. You'll see that they'll freeze and you got your face all contorted, right? So they're showing signs that something's going on, right? So that's a great thing. Like it might be funny or it might be like, uh-oh, I know. But you know that their body is telling them that they need to go. Because then there are children who they don't show any of those signs. So that's a great thing to see, is that your child showing signs that they know they have to stop and push. They know they have to, go in, uh-oh, it's going to happen. I need to go hide myself or whatever. That's a great thing, because you can capitalize on that. Okay, if you know where it's going, that's when you try to take them to the bathroom. A lot of times, do they show signs then? Well, there's no signs when it's happening or before it happens, but as soon as it happens, they take their own diaper off, they put their hands in their pants, whatever they might do. Are they showing signs? Because then it's showing that there's discomfort, there's something they don't like about that, and an understanding that they can remove that situation by taking off their diaper or whatnot. Have you noticed that they have longer periods of dry diapers or pull-ups? So that's also a sign, like, before, he's peeing a lot, a little bit, a lot of time, it's just kind of trickling out as he had to go. His diaper is constantly getting fuller and fuller throughout the time. But now do I see like, the diaper's really dry for more extended periods of time. Like he wakes up from his nap and he's still dry. He comes home from school, he's still dry. So that's also a great sign to see, because then you know that the bladder is able to store more urine, okay? So some of that readiness skills that we often work with, because as behaviorists we work a lot with problem behaviors, so there's a lot of time toileting is an issue and there's behaviors related to it. So a lot of times what skills that we work on to get a child ready for toilet training is just to transition to the toilet sometimes is a problem. So we see a lot of children with special needs might have limited play skills or limited interests, or they might be preoccupied or something or another. So a lot of times they're too busy doing what they want to do to be bothered to go to the bathroom, right? Like, well, he's wetting himself because he's in the middle of his cartoon show, and when he's in the middle of his cartoon show, he's not going to get up and go to the bathroom. Or I can't get him off that iPad to get him to the bathroom. Like he, screams his head off and doesn't want to go. He knows that that's not something fun. So a lot of times transitioning away from activities without difficulties is something that we first might need to work on. Like, well, in general, is this someone who, is your child someone that transitions to do any sort of demand? Like, do they transition to bedtime okay? Do they transition to go brush their teeth? Like, if it's a larger overarching issue, rather than just toilet training as being one of those things. So a lot of times we work on like the overall compliance with transitioning to non-preferred tasks, and a lot of times self-help tasks are not fun. Again, those social emotional kind of delays feed into that. So, most all of us, when we learned how to take care of ourselves, there was some sort of social buy-in for us, right? We wanted to be the good girl. We wanted to, we wanted to wear pretty underwear. We wanted to look nice or whatnot. So we also work a lot on just tolerating sitting on the toilet. So a lot of times just getting your child to sit on the toilet is a really big challenge. They're stiffening their body, they're screaming, they're kicking. They don't want to sit on the toilet. So we'll talk about some strategies with that. Also just compliance, again, that overall compliance with caregiver instructions. So if they're a child that isn't very compliant, then you're placing all these demands on them about toilet training is difficult. And then again, we work on desensitizing them to some of those fearful stimuli associated with the bathroom. So a lot of times we have to work on some of these core readiness skills in order to then say, okay, now we can start talking about bringing them to the bathroom on a routine or on a schedule and rewarding them and getting them to actually go to the bathroom in the toilet. We might have to spend quite a bit of time getting them ready to be able to then train them to actually use the toilet to eliminate. Okay? So the first one was the first readiness skill was that transitioning away. So a lot of times we just practice just transitioning to the restroom. Okay, we're going to, and it sounds really silly because sometimes you're just really practicing walking to the bathroom, and when they get there, then you give them a reward, and you might just say, okay, let's go into the bathroom, and you might read them a story or hang out for a minute or two, but sometimes just getting them to tolerate and walking to the bathroom is a good skill to practice a couple times a day, outside of just like we're going to go in there and brush your teeth or whatnot. So a lot of times we say to give a verbal countdown before the transition, to say, okay, and prepare them in like 3 minutes. We're going to go into the potty, or we're going to go into the bathroom. Okay, one more minute, and then we're going to go to the bathroom, and count down so that they're terminating and have time to prepare themselves before the transition. Go ahead.
I'm sorry if I misunderstood. Is this she actually sit on the toilet even if?
No, at
Okay.
this point, there are some kids that like just when you say we're going to go to the bathroom or take you to the bathroom, they're on the floor tantruming sort of thing. So this is more of that general trend. I think the next section deals with actually getting them to tolerate sitting on the toilet. But oftentimes we work with kids that just getting them to go to the idea, when you tell them it's time to stop doing what they're doing, that's an issue. Anybody experience any of that?
And it's getting a little better. Well,
Okay.
he's 5.
Okay.
And right now he's getting it. Like, say he's watching his favorite show, and if I say potty, no, he just drops. He doesn't want to.
Right.
And I'll say, okay, first potty, then the whole first thing,
Then?
he's
Mhm.
just getting it now.
Good.
So I kind of pause it, I don't turn it off.
Good.
And
And if you develop a routine like that and you are consistently using it, then there's an expectation there. Some of
Yes.
that control stuff is like, I know what's going to happen now. Like, I'm just going to go to the bathroom, sit for a minute and come
And then
back.
come back
Like,
and
and I
sit
do
there.
that all the time rather than like, my show is going to end. I'm in the middle of this. When am I going to have it again? Kind of feeling, so that you don't get that strong of a
it's
reaction.
only
So if
5,
you
I
can
mean, the whole-
consistently use those same using the first then, bringing them and pausing it instead of turning it off might be something, so he thinks like it's not totally ending, so those are all great strategies to use. But sometimes just practicing that before you say, it's hard enough getting him to turn off the TV or tolerate going there. Then when we get there, I got to sit there, and another big struggle happens for the 5 minutes that we're trying to get him to sit on the toilet and tolerate that. So I might say, let's just first work on that tolerance for getting off of the TV or getting off of the iPad or stopping what you're doing to go to the bathroom. So, and this might not apply to some people. It might be like, oh, that's no problem. But when we get there, all hell breaks loose kind of thing. So, but this is often a skill with a lot of our clients that we see. If they're not tolerating transitioning in general, then we might not recommend, okay, let's start toilet training. That's a great idea. We might say, let's get a little bit more compliance with transitioning and getting them used to putting some sort of routine, consistently use that countdown to let them know, and it might be that the first week or so you're going to experience those tantrums still, but then they start to develop this understanding of, I know what's going to happen now, and I'm okay with this. So the next is actually tolerating sitting on the either the potty seat or the toilet. And some of our other slides in Getting Ready will discuss how to choose whether you're going to use a potty chair or a toilet or the real toilet. But usually we say about 5 minutes is how long you want them to actually be able to tolerate. 3 to 5 minutes, because a lot of times once you get there, there's a lot that goes on for a child. Or for us, we could be done in that amount of time for sure, but we're also working with children that muscle and stuff and that control is something they have to learn to develop. So they need a couple minutes to start letting things happen down there. So we say just then, now that they're consistent, like if they are good with transitioning back and forth now when you get there, let's up the ante and make them sit down for a few minutes, okay? So we often say, like, if they're having a really hard time with sitting on the toilet, let's just have them sit for a very short period, and then they can get off again. So again, we're just practicing sitting, tolerating sitting. It's not about, we're going to sit and try to go. We're just going to tolerate sitting on the toilet. So, and this can be an excruciating, painfully slow process. My most recent toilet training client, she is 14 and she has cerebral palsy, and she's been in adult diapers since she was 6 years old or whatnot, and not toilet trained at all. Like, was told this girl will never be toilet trained kind of thing. And the thing was, she would not go to, we worked on just going to the bathroom, so we would leave something in the bathroom for her, like, okay, let's go to the potty, and when you get to the potty, that's where your burning video will be, or that's where your, she likes these little scarves or whatever, let's go to the potty, and when we get there, then you can have that kind of thing and bring it back with you. So she worked on that, and then to get her to sit on the toilet, she would throw herself back and like hit her head kind of, she'd like slide down and hit her head on the back of the toilet bowl thing. And she would like huge head hitting kind of things. So it took us about 6 months to get her to stop doing that. And it was really just practicing sitting down. And at first she just had to sit without banging for like us to count to 3, and then she could get up and have her reward. And then once it was 3, then it was 5. Like we just added and added to it until she got to like, once she got to about 2 minutes, then we jumped it up to like 3 minutes and 5, you know, like we could make larger leaps because she was tolerating it more, but it took us that long to get her to tolerate sitting on the toilet. So she now is going to the bathroom 3 times a day in the toilet, and it took a little over a year. But I mean, she's 13, and mom was like, if something is gonna, her learning rate might be or acquisition rate might be a little slow, but it's an important skill. We're not talking about like she's gonna learn to like the piano or something. It's like an essential skill, bodily functions, and it impacts children in so many different ways. Like having children with special needs and like not being toilet trained exposes them to so much more. Like they need assistance in the toilet, which exposes them to people coming in. They're getting familiar or used to just people seeing them and touching them and helping them. So as much as like this took a long time, like it's definitely worth it. Like she's now 13 or so, she is developing and puts her at a great risk. So now if she can learn to do these things on her own, that would be really meaningful to the family. So they really put the time in. So we systematically increase the duration of the interval, like I said, and sometimes you can start to make those larger leaps, but really sometimes it really is. We're going to sit here, and we can count to 3 without you banging your head on the toilet, or we can count to 3 without like physically holding you down while you're stiffening your body. And sometimes you just start with 1 second. Sometimes you just start with, sometimes it's with or without. We actually started, she had to sit with all of her clothes on. So we just practiced sitting with all her clothes on, then she had to take down her pants and sit with her pull-up, her adult diaper on, before we then started saying, now you have to take the adult diaper off, that sort of thing. So a lot of the ABA and what we use is to systematically really focus on things and take a big skill like toilet training and tease some of the small steps out of it and really work a lot slowly for them. And it's, I think for parents too, or even professionals, like, okay, we're going to toilet train someone and throw them into like everything. You're inevitably run into like so much disaster and so much disappointment that it gets frustrating. And who wants to work on it when you're never successful? But they now walk to the bathroom. They're doing something. That's a step forward. That's a lot more. That's something positive that the child can experience, that caregivers can experience, that the clinicians working with your child can experience. So we often start kind of with the small steps and kind of up the ante slowly. So we do say that if you want to count while they're on the toilet, like we're going to count to 3. This girl really likes singing, and so we would sing this counting song with her up to 3. If it's that you play a part of a song, and when they get to a certain part, or when the song's over, they can get up. Whatever it might be to help them understand this is how long you're going to sit. Again, that control thing and having really clear expectations of like we're going to go to the bathroom and then you're done and then you get to come back and watch TV, just like we're going to go and sit and you're going to only have to sit for this amount of time. Like they know that, that control issue, like this amount of time or until this happens, and that's going to be when you're going to get off the toilet, rather than how long do I have to sit here, like that. So they know ahead of time what's expected of them. So a lot of times, like if you're getting towards that 3 to 5 minute mark, for 3 seconds, preoccupying them is, not really much of anything. But we do allow and recommend that at times that if they need something to kind of keep them busy, because remember, right now we're not worrying about whether they're going to if they're eliminating or not. We're just wondering. We want to make this a positive experience, right? We want it to be that you're going to come in and nothing bad happens to you. See, it's not that bad. And in the end, you might get a reward. So while you're here, I'll make it enjoyable for you. I'll sing those songs you like. I'll bring those books in you like. I'll talk to you or whatnot. So make it a positive experience to be in the bathroom and not all terrible. So while they're sitting throughout the time, we definitely say always positively reinforce them. Tell them good night sitting, look at you. You can even throw in, you're such a big girl, whether it means, or big boy, whether it means anything or not. But throughout the year, sometimes letting them know, good job, you only have 30 more seconds, good job. we're almost done. Keeping them kind of busy and preoccupied is a great thing. So oftentimes we ask, and we'll go over again when we talk about getting ready, choosing the rewards that you're going to use. We can talk a little bit more about how you do that. But consistently having a reward that it's something that the child likes that they get afterwards. Like they don't really care to sit on the toilet usually, but if there's something in it for them, they will, right? So if there's something like, oh, then I get to go back and watch my video, I know that if I have to get this done or else I can't go back and use my video, that's motivating to them. Or, go ahead.
How often do you do this, like throughout the day?
It really depends. We tell parents the more you practice, the quicker it goes, but it's also that you don't want them to be sitting on the toilet. You don't want it to be too terrible. So sometimes we might say pick, 2 or 3 times a day and just work on this. And then they'll get in. If you can make them the same times in the day, like he knows that I sit on the toilet in the morning when I get up, and he knows I sit on the toilet when I get home from school, and he knows I sit on the toilet right before bed. That also helps to have that. And maybe it's like, well, it would happen this way, the tolerance might happen quicker if he's practicing more often, but you also want it to be something that's not punishing. And so taking to the bathroom 20 times a day just to sit there is, kind of silly and punishing. So we often say, like, start with something that you can do and commit to, and the more you can make it something that is some sort of routine where there's that expectation, and so then they get used to, they know that, yes, this is what happens. Like, so there's all that overall compliance that you're working on. So, sometimes we, work just on toilet training. We go out to the home. We might say, and when we're here, the child knows we're here for therapy, so we put, we might go 3 or 4 times in an entire, like for this little girl that I was talking about, we would go like 4 times in the 2 hours we were there. I mean, there was a huge tantrum to, for a while just getting her there. So sometimes it would take us, a half an hour she was also a very big girl, to get her there or whatnot. But the more you can practice, the better, but definitely don't like overdo it and make it like a terribly punishing kind of thing. So, if you can, okay. So that compliance with the overall instructions, again, if this is an issue, we talked about getting them to comply, just going, back and forth to the bathroom, but sometimes the overall compliance, I generally do not recommend starting toilet training for a child that just isn't really following a lot of directions to begin with and is very, whether they're verbally like, no, or I don't want to, or they're running away, or they just ignore you or whatnot. Like if you don't have compliance with every day, like sit down, and you think it's stuff that they understand, if you think they're actively being non-compliant, not that they don't understand, that, not understanding what's asked of them is one thing, but knowing what's asked of you and then not wanting to do it and not do it is another thing. So if your child falls into that second category of like, they really just are non-compliant with a lot of things I ask them to do. Like compliance is not one of their strong points, Like if I ask him to do something and he knows what it is, he intentionally doesn't want to do it. Like he will continue. He heard me ask him to do something, but he doesn't want to turn off the TV. Or he heard me and he knows what he's supposed to do, and he's got his little smirk on his face. Then we say you might want to work on some general compliance, because then to get into the bathroom in this tight, squeezed area and hash it out is even more difficult. So sometimes we recommend just increasing their compliance. We work in clinic or in-home programs that we might say your child might not really be ready for toilet training yet, because they are, not generally following directions. To then have this huge demand that even typical kids resist and have a problem with is going to be that much more difficult. So sometimes we might just recommend some overall compliance training, and it just generally means that whenever you place a demand, to follow through, even if it means dealing with that big tantrum that might come. So then the kid knows, like, well, mom and dad asked you to really do something, you have to, you generally have to do it. So now that you get that part down, the big demand I'm going to ask of you is the toilet training, okay? So the fear-inducing stimuli, sometimes, it really might be about some sensory stuff, and sometimes you might really think you know what it is, and other times you don't know what it is, but it doesn't, so a lot of times, whether it's the light, the ceiling fan is a huge one for a lot of kids. It makes a lot of noise, so if you can turn that off or not, whatever it might be. A lot of times, if you're using a large toilet and they're like sinking in, like that's not fun. The flushing of the toilet, like, so we might say like, well, you know, he's not even going yet, so like, let's just not get him to flush the toilet yet, and we'll work on that later. Or sometimes we'll say, let's just like first just work on the flushing. So it really, you know, there's so many different things that I can't give you a specific recommendation of, you know, what to do. That sometimes you really have to work and say, what is it about this that is producing this fear response, and to work on that, and sometimes more systematically. Like if it's flushing the toilet, then I say, okay, like you stand here at the door and mommy's gonna flush the toilet, and you have like get them to just stand at the door. I'm gonna flush the toilet, you're way over there, nothing's gonna happen to you, and just work on it that way. Like mom's flushing the toilet. Then get them to come in like, you know, now I'm going to flush the toilet and you're right here with me, okay? Now we're going to flush the toilet together kind of thing. Or I'm going to hold you and flush the toilet. Like get them to, you know, accept it a little bit more rather than them coming straight in and flushing it. But that might be the ultimate goal. So with the fears, we kind of systematically target it. You know, there's an argument about, you know, as a psychologist, we talk about like that's what's called systematic desensitization, taking a fear and kind of systematically chipping away at it. Like, you know, if you're afraid of snakes or spiders or those sorts of things, like, you know, there's two different methods. There's systematically desensitizing you when we might say we're going to look at pictures of snakes or talk about snakes, like, or spiders. Spiders are worse. Like just looking at spiders, those big hairy things is like something that like gives me chills kind of thing. So it's like first you're going to do that. Then we're going to go to the pet store and actually look at them, you know, rather than here, I'm going to put this on you and you're going to tolerate it kind of thing. So with a child, we do the same sort of thing systematically. But then there's also a lot of research about what's called flooding. And that's just like, let's just throw them if you're afraid of heights, like we're going to go skydiving, that sort of thing. So research has shown that reducing fears, it's quicker and more effective to do the flooding, but it's not a method I would use. It's not a method we often recommend using with your child. Like if you're an adult and can make that decision for yourself is one thing, and then your child, like when you do all the flooding sort of stuff, like then there's also this mistrust that might form, like, you know, mom's just gonna throw me off the plane. Like the way I learned how to swim was that my dad rowed all of us out into the middle of the lake and threw us over, you know, like not a good thing. Like then nobody wanted to go swimming with dad, out in the boat with dad anymore because he would just throw you over. So that trust might be broken, but I'm just letting you know, like the research shows that the flooding technique is more effective. You know, it's less time consuming, that sort of thing. You're just dealing with one big screaming your head off, trying not to drown, rather than the multiple little tantrums and whatnot. But for whatever reason, you know, just want you to know that's the research, that there are different, you know, camps of thinking, and sometimes you might work with people that recommend one over the other. But that you know that those are the different types of approaches that you can use if you'd like to use. And both of them there's research to support them. It's just that the flooding there's more research to say it's more effective, but we don't usually recommend it even though, for all those other reasons. But the idea is that you expose them rather than accommodate them all the time. That again, you could figure out a way that you can systematically, like I said, with the flushing of the toilet. If it's the sitting on the toilet, like I said, like they're going to sit on the toilet with the lid closed, with all your clothes on, you know. And then once you do that, then I'm going to lift up the lid, and then you're going to sit with all your clothes on the toilet. Then you're going to take off your pants. Then it might be like we've even worked on like, we'll let you wear, they'll start wearing shorts because for some reason they think that's, you know, better than than having nothing on, that little bit of comfort. But that you're working systematically on it. Like then you can, you know, we've even done with some kids like cutting holes in their diapers or whatever, you know, cutting away their diaper. For whatever reason, if the fear is there and the resistance and the control is there, some of these more systematic methods are often recommended. Okay? So then, rewarding the child for tolerating the fear, often removing the stimulus is what itself is very reinforcing, right? Like I know that I have to sit here, then leaving that situation isn't enough a reward, but sometimes we add that external reward, whether it's the candy or the iPad or the movie or whatever it might be. Okay, any questions about, I mean, we're gonna go into a couple of different things about getting ready, but.
Will we have an opportunity to talk about
Mhm.
Insists on taking everything off. Socks,
Uh-huh.
shoes, this, that, or else he won't do anything.
Yeah.
Yeah, I mean, not the upper, but the lower. So, of course, you know, he's like, take off, take off, take off.
Yeah.
So it's hard because you're in a public
Restroom.
It's like,
And it's
I
gross.
can't take off.
We also want to check in and make sure what they're doing at school, because sometimes they might have them do that at school too. So you want your home and school, you want that consistency, because if he's coming home and you're only bringing, maybe you only bring him to the toilet twice, you know, most kids spend the majority of their day at awake hours at school. That's the reality of it. So if they're going to the bathroom 3 or 4 times at school and that's the way they do it, then to have once a day or twice a day you try to change it, you know, the resistance might be that the routine is different and this is the way it's supposed to be. But you can work on systematically, like, you know, you might want to practice at home a lot more. Just take him to the bathroom and him having to keep his clothes on it. It might start with just, you can only take off your shoes right now, or, you know, you can only take off your socks, you know, and trying to get him to add more and more to it.
I think in his mind he might think it's gonna get dirty. Maybe that's what he's relating. It's bathroom. So I gotta take off everything.
Well, my son does the same thing. I mean, he's not, I don't think he's quite at the level. He
Yeah.
doesn't go in public restrooms, but
Mhm.
sometimes he'll go and he will want to take off his shirt. You know,
Mhm.
I don't know if, my husband may have done
Done that, yeah.
Someone
A lot
did
of
that
time,
some
those
point.
sorts of things
They
are
will.
related to like that routine and like,
Right.
this is the way I did it the first time I did it, so this is the way I'm supposed to do it, that sort of thing. So we would say work on him. Again, it might be like he has to keep one article of clothing on, you know, just socks, or just, I guess shoes wouldn't be going. You can only keep your socks on, you know, and then, okay, now you have to keep your socks and your pants on. Now you have to keep your socks, pants.
I've been doing it.
Yeah, well, out in the public too, I'm sure, in the middle of the nasty restroom when you're on the floor. Who wants to battle it out then? Like, don't touch the floor, please. Okay, just give them to me, just finish. So, like, you know, we do work on toilet training a lot more in the comfort of your home when there's not all those nasty things, and, you know, where things can easily go into the washing machine and whatnot is a lot easier. So when getting started, we want to, you know, when we say, okay, we've worked on these readiness skills, he tolerates walking to the restroom, he now will sit on the toilet for a couple minutes, maybe now he's not afraid of the toilet, and maybe now he keeps all his clothes on when he goes to the bathroom. Like, okay, we got some of those major obstacles or challenges down. Let's like start actually doing the toilet training. So we want to decide what the language around toilet training is going to be. And again, the more it can be consistent with other major players in your child's life who toilet them, whether it's school, whether it's he goes to grandma's house for 3 hours every day after school, and I know she does some stuff with him. You know, the more you can make it consistent across environments will kind of speed up some of that learning. So whether it's what you call different body parts, whether it's your pee-pee, your penis, your, you know, whatever you want to call it, but that everybody is using the language, first of all, that you're comfortable using, and that, you know, there's some consistency there, as well as like whether it's pee-pee, poo-poo, poop, wee-wee, whatever else you might want to call it, going potty versus going to the bathroom, like let's go to the restroom, whatever it might be, that there's some understanding that you're using the same terms with your child to speed up kind of that learning and those expectations. You also want to consider the child's developmental level. Like, you know, parents like sometimes, you know, like, oh, we gotta go pee-pee, you gotta, because then your teacher won't be mad at you. And then, you know, they're giving them these long rationales of why you should be peeing in the potty or what it might be. Consider your child's developmental level. Most, when you're starting to toilet train your child, are still kind of at what we call a concrete operational phase, when abstraction really isn't something that the child's brain really, you know, grasps. So when you start talking about these, like, you know, some people have these weird well, not weird, but have these stories about, like, you know, we go here and then there, and like at one time someone was talking about the poop fairy. It takes your, you know, like, those sorts of things, like that's like some abstract, and then somebody's thinking there's a fairy sitting at the bottom of the toilet waiting to collect something or whatever it might be. Let's go feed the poop fairy is what she used to say. So I was like, what is that? Like, that's just creepy. But like, that's a very abstract idea, and instead the child now thinks there's something living in his toilet, you know, like, and now that's a fear. So whatever you're going to use, make sure that you understand that your child's developmental level is primarily at, you know, I mean, even if you have a 10-year-old, if your 10, 12-year-old is not yet toilet trained, it's likely because they're developmentally delayed in some way, and they're probably more at a concrete than an abstract kind of, you know, if they haven't mastered toilet training yet, kind of gives you more of an indicator where they might be cognitively and emotionally. So generally when you're toilet training, your child is often more at a very concrete, like pee goes in the potty, and that's where we get those recommendations, like when we might start with like once he poops in his diaper, like the first thing you do is teach him that the poop actually should go into the toilet. So that's when we have people dumping the poop with the kid from the diaper, right? You know, people do that, or recommendations like he poops in his diaper, you take the diaper with him, show him that this is where it goes, you flush it down here. So to teach them that's like kind of the very concrete, that's where it goes, okay? They're also like very, the various books for children about toilet training, and be very careful again about that abstraction that might be involved, as well as a lot of times the books and stuff often deal with that social emotional content that, and then you're going to be a big boy, and then you're going to, just like mommy and daddy. So it might not be a very useful tool. I mean, it might be fun to look at, and it has Elmo sitting on the toilet, and he can push the buttons that make the noise. But if it's not really helping, so a lot of times, have you guys heard of those social stories? Has any, like an individualized story? So it might be good to have a very concrete, like we're going to walk to, you can pause your movie, or stop whatever you're doing, and then walk to the restroom and take down your, and keep everything on. You're going to keep your socks on, you're going to keep, you know, like spell out like really concretely what you expect them to do. You know, pictures or whatever it might be helpful to, you know, again, with the language you're using with them, be as concrete as possible, okay? So that's why, like, pausing the TV is often a more concrete way for them to understand, like, I see that it's not off yet. So when you say you can come back and watch it again, but you turned it off, concretely it's off. Not understanding, like, abstractly, like, but it can be turned back on, you know, and it will come later. Then instead it's concretely paused, and they'll know that it's still there when they get there. So that's why a lot of times those sort of strategies work developmentally. Okay, so the next thing is diapers versus underwear. A lot of times people will say, if you are going to toilet train your child, just throw them in underwear. Like, that'll do the trick. But a lot of times, you're probably sitting here because that hasn't done the trick, and instead all it has gotten you is a lot of soiled clothing, messy sofas, you know, all these terrible, terrible, terrible things that has a lot of laundry, a lot of stinky things going on. So you want to consider how frequently they've been eliminating. Like if it's, again, someone that's like dripping constantly, like where, you know, that they haven't been holding a lot yet, that if they're going constantly, then having them in underwear is not probably highly recommended. Consider how frequently you're going to give them opportunities to use the restroom. Like if you're going to say, oh, I've decided I'm going to bring him, like again, like in the morning and after and whatever. It's like, well, if you know he goes to the bathroom much more than that, why would you put him in diapers? I mean, why would you put him in underwear? You're just setting yourself up to get a lot of wetness. So maybe right now, bring him consistently on that time. And if you see that it's starting, you see now that he's remaining dry, then you can transition into underwear. But if underwear sometimes are motivating, like especially for boys or girls, they have all those princesses and Spider-Mans and the, you know, Iron Man. If that's something your kid's into and likes those underwear, you can put the underwear on top or under the diaper. We often recommend to put it under the diaper, the underwear, because especially if your child is someone that feels the sensation that they're wet, and they don't like that, because diapers these days are so good at removing the moisture from your body that you can go and not really feel it, so there's not that discomfort. But if you put your underwear inside, then that's going to stay at their body, and there is going to be some of that discomfort. Yeah. And over underwear, yeah. But then the parent's like, well, then I got to still pay for pull-ups, and now I got all this laundry. So, I mean, we deal with different families, and some people don't have washer and dryer in their home. So it's like, well, yeah. So there also are, it's very hard to find, but there also are those plastic underwear. They don't work as well as a diaper does if you put them on, because there's creases and room for them to move and whatnot, and they make a lot of noise and stuff like that. So oftentimes we recommend put the underwear and then put the diaper on top of it.
And what about doing it partial, like doing it for 2 hours a day, keep them underwear?
Right, and so when we talk about the method that we kind of recommend, like, okay, if all these things, this is kind of a method we recommend, it'll say to put them in underwear, because if you're targeting and you know you're going to bring them frequently,
Yes.
and you're going to be able to catch it, sometimes we say don't even put them in underwear, let them run around, if that kind of thing. But yes, we generally say put them in underwear when they're doing a more consistent schedule, yeah. But if you're working with someone that's just getting them to tolerate sitting and bringing them and getting them used to the concept, and you've decided you're going to put them on a natural schedule rather than a time-based schedule, we would say generally start with the underwear under the diaper. So again, I think I covered if the underwear do serve as a motivator, again, you can still use them even if they're not completely ready with it. Okay, so the toilet versus the potty chair, consider if there are fears of one or another. The physical size of the child, again, if I'm toilet training a 13-year-old, she's definitely not sitting on she's definitely not going to fit on a little potty chair. Whether you want them to sit on, on the little separate seat on the floor, they have those little seat covers. You also want to consider, is your child someone that gets really stuck on things and gets used to those, this is how things are done? Because if so, it might be while it might be easier now to sit them on that little potty and whatnot, well, at what point are you going to transition them to the toilet? And now that's going to be another issue. So we'd say, might as well just start. If you know your child gets really stuck and persistent about things being the same way all the time and has that kind of control, then it might be beneficial to just, go straight for, the big chair, like the big toilet. So you want to consider those sorts of things. And then also that if that little potty isn't available in other environments, then again, the kid might be coming home and waiting to use that potty because I don't have that anywhere else and that's what I go pee on, instead of, oh, that big potty looks like mommy's big potty, it looks like the teacher's, it looks like the one in the restaurant, it looks like this, it looks like that. I also would recommend about the potty seats and the potty chairs. I am someone I don't like to use public restrooms, and I'm from Massachusetts, and we don't have, I think you guys have a law here, the public restrooms have to have those nice little seat covers, which is the greatest thing ever. Yeah, but generally they have them.
Yep.
And so, I remember my little nephew, I brought him to this country kitchen breakfast place, and he was just learning to potty train. So he had to go potty, so we go in, and it's I grew up in a small area, so it's a backwoods kind of little place, and I bring him in, and it has a wooden toilet, a wooden toilet seat, the wooden ones. And so I was okay, Auntie Paula's gonna, so I get the toilet paper and I lay it out on the seat, and he's like, what's that? So then we're just gonna put you on, don't touch anything because I don't want to clean up after it, that sort of thing. So we get back to the table and he decides that he figured it out. That Auntie Paula put that toilet paper on the toilet so he wouldn't get a splinter in his bum. And he thought it was So then he told the waitress I did it, he told everybody. Everybody was like, Auntie Paula has some problems, huh? So again, consider, what you're comfortable with, but also, if I am teaching him that that's what you do or whatnot, that might become a pattern for him, and he might not, I should ask him if he thinks that if he still toilet papers the wooden seats so he doesn't get a splinter in his bum. But, kids pick up on some of those sorts of things. And the next is the sit versus stand, especially with boys. Again, if your child, we generally say start with sitting because they don't have any control, and they don't have any control to stand there for 5 minutes, good luck with that. And then when they finally go and they can't control it, it's good luck with the mess you're going to make kind of thing. And then it also helps with, you generally, when you start toilet training, you're starting with, you just want them to pee in the potty. The pooping, comes when it comes, and you might not know when it comes, so it's harder, to capture when that happens. So instead we say, start with the peeing on the potty and maybe transition. We generally recommend to transition to standing once your child is also, having a bowel movement on the toilet, because then they can learn to discriminate when you sit versus stand, and have like more control of that. You have this look. Go ahead.
He's past 5 and he's still sitting, obviously.
Okay.
And I haven't pushed him to stand.
But he's not toilet trained yet, right? Completely? Yeah. So I say once he's going and he's peeing versus pooping is a concept he understands and has control over both of them, then you teach them when you have to go pee, all you have to do is stand. But if you have to, I don't know, there's only one guy in the room and we could put him on the spot.
Is it okay to sit?
When you have to poop, do you sit to pee too? We won't film you, but we can.
Oh my gosh, I didn't know that was coming toward me. I was I'm sorry, ask me that personal question again.
Only your voice is on camera, so
Right.
we can muffle it like whoa, 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 whoa. Put a cloud over your face. If you have to poop or have a bowel movement, do you pee sitting as well? Or do you stand, pee, and then turn around and poop?
Oh, no, it all happens in the same
same
position.
Okay.
Yeah.
Does that make sense? That's generally, yeah. Yeah. Like we went over teaching like boys to like, because we also work with I work with older boys too, and so like we're teaching them appropriate bathroom etiquette, because then the mom's like, and then he goes in the bathroom and he's like, hey, like, talking, and like there's a lot of etiquette with the boys, like men's room. You don't talk to people. You go in and do your business, and you certainly don't look at them, and you certainly don't, just don't talk at all. Just go in there and get out kind of thing. And you certainly don't take off all your clothes or pull your pants down over your bum kind of thing. But we have a lot of kids that like they have not learned yet to discriminate when you do and don't do that. So I have spent some countless hours with some of the men on our team to talk about like, so how do we teach that? Like, so do you unzip? If they're wearing boxers versus like underwear, like what do you do? What do you call it? How far down? Where do you put your hand? But it's just so be glad you didn't have to participate in those. But when we're talking to kids and we're like making those step-by-step task analysis that we make, or routines, and we're teaching them like what to do, where to do, that sort of thing, like those become more important.
Or more like when I think, at what age do I actually can't stop taking them
To the bathroom, yeah.
Think about that.
Yeah.
I wanna say around 10, because my son is 15.
Yeah.
And he noticed he didn't wanna go to the women's bathroom anymore.
And he went by himself to the men's?
We had to work on it.
Yeah.
She's saying, like all the steps, don't pull your
Pants
pants
down
down all
over
the
your-
way down if you're peeing standing up.
Right.
But we ask him before he goes in the public bathroom, is it number 1 or number 2? And then it says number 1, okay, so then you're gonna stand up. And
Right.
remember, don't pull your pants all the way down, and just open your zipper and, so.
Because
and
some of
we
the
just
like
have to
if you
remind him.
like they aren't distinguishably have special needs, then it just looks like this creepy boy in the bathroom, versus if they look distinguishably different and now they're acting different, then it puts them at risk of somebody taking advantage of them. So you do want to, so we generally say, to teach them the pee and the poop in the toilet, and then get them to learn to discriminate. When you have to go, once they understand and have control over it, then more likely to understand if they need to pee or poop. Not just, I'm going to go sit because mom's making me sit, and if something comes out, I get something, that's cool, like that sort of thing. Once they're able to distinguish them, we say start working on teaching them, like, is it number 1, number 2, is it this or is it that kind of thing.
Thank you.
Okay? Okay. So when we get started we want to talk about schedule. Like, okay, so we got some of this other stuff figured out. So when are we going to bring them in? How often are we going to bring them? Or what we're going to do? So there are a couple of different scheduling kind of issues or scheduling options. The first is that we generally then say just work with the awake hours, like expecting them to stay dry. You need to put them, even if they're staying dry most of the day, put them in their pull-up or whatnot, or in their pull-up over their underwear or whatnot when they go to bed. That's a much harder concept to deal with. So then there's the routine-based, the natural kind of time-based and then more of an interval-based approach. The routine-based is to choose, again, within your routine rather than at 1 o'clock, 3 o'clock, and 4 o'clock, and oh my God, it's 1:05, I gotta get you to the bathroom. That instead it's a natural kind of like, I know, and this is what school often does. They take them and it's part of their school day, right? We have 4 routine-based times of the day. It's, when they get off the bus or right after circle time. It's, right before lunch, and then it's half an hour after lunch, and then it's right before the end of the day before we get them on the bus. So then the child knows that that's coming. They know that that's always going to be there, and then, that becomes part of their routine. It's much easier to do at school because school is very structured, right? School, they have a routine all day. The teacher generally does the same thing with them every day. And sometimes at home that's not, Monday looks different than Tuesday looks Wednesday, because Monday I have speech and Tuesday I have this, and Wednesday I have to bring him here and then his brother here. So it's a little bit more difficult at home to get the routine in. But there are certain things that they have to do every day. Usually eat and sleep are the 2 main ones. So we say those are great times to judge, eat, sleep, and go to bed. Or wait, eat, sleep, that's part of sleeping. Yeah. So we say try to make your routine around that, because those things will always happen, and if you always have them do it before they go to bed, then that will always happen, and that will become part of their bedtime routine. School is the 3rd one, so most of them go to school, but then the weekends are a little bit off, but before school, after school, that sort of thing, okay? Then the natural schedule, often we say, that's about more paying attention to your child's natural schedule. So sometimes some of our kids are very consistent. They have very consistent bowel movements or very consistent times of the day where they, I know that after he has his bottle or whatever, or I know after he has dinner and he drinks like 3 cups of water or 3 cups of juice, that he's going to have to, he usually pees within a half an hour, like his diaper is totally wet kind of thing. So if your child has that consistency, or even if they don't completely have that consistency, if you have a very consistent lifestyle, it's more likely that they can develop that, right? So if you're not a family that eats at a consistent time or goes to bed at a consistent time, and it's like, sometimes we have dinner at 5, sometimes anywhere to 7. It really depends on what day of the week it is and when Dad gets home from work and traffic and this and that. Like, it might be hard to do a natural time-based schedule, but if you have a very consistent kind of routine in your home and in the child's life, it's oftentimes that your body starts adapting, right? How many here use an alarm clock to get up in the morning? How many here can wake up before their alarm around the same time? They don't really need the alarm clock. You probably have a very consistent kind of schedule, and your body has learned that that's when it wakes up, right? So it often does that for you. Or if you eat lunch at the same time, like your stomach's growling 15 minutes before lunchtime, because your body is very trained on when it gets the sleep and when it gets the food it needs. So if your body is, if you have that same sort of lifestyle for your child, then setting them up, you'll be able to, generally their body will learn to adapt and have those sort of time-based patterns where, your body knows, every time it eats, it takes about a half an hour to digest and whatnot. So sometimes we often say to use a time-based schedule. A lot of times we'll do that more with the bowel movements. And a lot of times, because bowel movements don't happen as frequently, you want to catch them and bring them to the bathroom at a certain time, we say to use a time-based schedule. Thank you. And then the last is an interval-based schedule. And that's simply when you are going to start bringing them a certain number of hours or certain number every 30 minutes or every whatever it might be. That we're going to talk about that type of schedule as being a more intensive type of schedule. But that one's often more difficult if you have a lot of stuff going on to follow, because it's like, I'm supposed to bring them every 2 hours. Well, I don't know where I'm going to be every 2 hours. Like, some days it's this, some days it's that, or, if your life isn't, sometimes you'll work with clinicians that'll be like, it's because you need to. If you don't, you're a bad mom. You need to have a very routine, But your life is your life, and there are different things that come up, and if not, then you know that that's just not something that's going to work for you. And if it doesn't work for you now, chances are it might not work for you in 2 months when you might still be working on this. So it will all collapse and not be very effective for you. So you need to find something that works. So a lot of times that's where we say, well, then let's just set up a natural routine-based thing, and let's start just sitting him, you do have to eat, and you have to have, go to bed and go to school, right? You have to do those sorts of things, or you have other therapies, so maybe it's before and after therapy, whatever it might be, to stick to that one. But really finding a method that works for you and your child. He's not going to, Mommy, 2 hours, gotta go, but he might remember and bring himself right after, you come in the door and he goes to the bathroom because he knows once I'm done with this, then I get my TV, so they might be more likely to initiate, to comply with if they know when it's coming. And oftentimes that interval-based schedule, isn't something that is as predictable. So I think that one of the last, no, there's another one after this. One of the other issues is requesting. So we often say, again, that from the very beginning, this is something you should be considering, is how your child will communicate or get themselves to the bathroom. When we start toilet training, it's usually all based upon, I want you to go, right? You're going to go because it's time to go. It's that time of the day. It's that time of the routine, whatever it might be. Then the child learns to go to the bathroom only when you bring them. So we want to start getting them to learn to indicate or tell you when they need to go. So oftentimes just requires some tricking them into thinking that they told you or whatnot. So deciding if, it's going to be saying potty, if it's going to be saying pee-pee, you want it to be something that, depending on how old your child is when they are in other settings, that it won't be embarrassing for them or for you to say. Whether it's a sign, sign language, and maybe it's not the sign that, whether it's, they aren't going to do this, but if they did that, I'd be so happy, you know what I mean? Because I could get them there in time. Decide what your thing's going to be. And then anytime you're going to bring them to the bathroom, avoid just telling them it's time to go, but instead try to get them to communicate with you. Like even if you, say, oh, what time is it or whatever, and then, or before you go each time, getting them to sign for, oh, you have to go potty, thanks for telling me, even though you're the one that went up to them and told them it was time to go. But that you're practicing every time you bring them, that's what you do before you go to the bathroom. That's part of that routine. Part of that routine is that communication, right? Before traveling to the bathroom, opening the toilet lid, sitting, pulling your pants down or whatever, the first thing you did was you communicated in some way that you had to go, okay? And then there's some discussion around like, well, if they're in the home, I want them to just go. Usually when you start toilet training, most of your children are still needing help physically, pulling up and down their pants, wiping themselves, that sort of thing. You don't want them to, some children are stuffing the whole roll of toilet paper down the toilet. So when we first start, we generally still are working in a situation where the parent still needs to provide some assistance. So, getting them to communicate is ideal. And then when they're outside of your home, which we've said is actually where they spend the majority of their time is at school or whatever, they're not going to be allowed to just get up out of the seat. At school you have to raise your hand or you have to, ask to go to the restroom. So think about those sorts of things. What's going to be the most beneficial for them? And again, avoid asking the child to if they need to use the restroom. Number one is because then you give them the option of saying no. So don't ask a question. They can't say no, because then that compliance issue comes up. So avoid asking, do you need to go potty? If there's not if you're not going to let them say no, you're still going to just bring them to it's time.
That's 90% what I do. Like, Patrick, potty? No.
No.
Instead of saying, okay, let's go potty.
Okay, it's time to go. You're going whether you like it or not.
Yeah, that's interesting.
Yeah.
I ask him, but sometimes he says yes. When it's not quite time, but he looks like he needs to go, then I'll ask him. He'll say no like 90% of the time, but then a few
Well,
times
just
when
think
he'll say
about
yes.
when you want him to start on his own saying it or bringing himself. So instead of saying, do you need to go potty? If he looks at, remember, we need to go potty, what do we do? Like you're just, and then they're supposed, I need to go potty, because then you're at least you're not asking them, you're instead kind of reminding them that if you need to go, what are you supposed to do? So you might just want to switch the language a little bit, that kind of thing. So, any more questions about the requesting part?
I've heard that comes last.
Oh, well, I recommend you start as soon as possible within the routine, because then it's not, now your child's used to just going when you want him to go, when you ask him to, when you do a schedule.
We do a schedule now,
Okay.
and he's dry if we keep on schedule, but if I forget or don't keep him on schedule, he goes.
Okay. Yeah, so that's why we work on this requesting.
And he'll tell me, he went, but he always tells me after he's gone. Always
After. So did you start with a reward system?
Yes.
And he was rewarded when he went?
Yes.
Yeah. So we sometimes, because we get called at all stages of like, oh, well, he's kind of toilet trained, but I have to remind him to go. And we have lots of older kids like that, still like, well, he's just been doing this and now he's 10 and he's never learned to. So we say now we change the reward, and the reward comes for staying dry. So you have certain times of the day where you check your pants. You know, you have like a dry check and you say, okay, if you're dry, then you get the reward kind of thing. Remember, if you want to stay dry, that means on your own, you need to start bringing, right? That now, then throughout the day, you remember if you want to earn your whatever, you got to, and you need to go potty, you need to bring yourself to the potty. Remember, if you got to go potty and you want to earn, you know, then you've switched the kind of,
No more schedule.
yeah, that's what, you know, sometimes they'll say stick to the schedule, or expand the schedule, so now move it to,
My kid's still little, he's not still
okay, so how often do you bring him now, or what's this?
every 40 minutes.
Okay, so you might want to expand the schedule a little bit more,
I've tried that and then he'll.
and then he'll pee, okay. Well, then the reward might be like every 30 minutes or 15 to 20 minutes, that. And sometimes you can use like a token charge, you know, giving them something every 20, 30 minutes, but the pant check comes, because then he's going to remain dry, because that's something, you want him to be successful for it. So you might set up like every 20 minutes or 15 minutes you're checking with, are your pants dry? Awesome, your pants are dry. You know, now, you know, and
But
now you
don't
get a
take him
reward.
anymore to the bathroom, so I can
Yeah, I
just
would,
stay.
yeah, but it short in interval, so he's successful. So, yeah, yeah. I mean, I could tell you more specific details, but then you switch it and it becomes to stay dry, and you're just, instead of telling him to go, you're just giving him reminders all the time. Remember, and yeah, if you need to go, remember, you got to tell mommy, you got to bring yourself to the potty. And that way too, if you use like a token system, or just every time, I don't know what you use there as a reward, or, you know. He calls people? Like, oh, okay. I'm dry! Well, it will be like every 15, 20 minutes, so that might be a lot more calling, but
40 minutes, yeah, every
40 minutes.
He calls and he says, I'm dry, and I pee.
Oh, that's cute. Okay. So, and you might want to, if that's not going to work every 15, 20 minutes, you could change it to like a token system. And that way you never lose a token, like, because then if he has an accident.
Well, he can get the phone call when he initiates it.
Right.
instead,
Mm-hmm.
maybe.
Or he gets the phone, when he initiates, he can get it, or he can get it for staying dry too. Sometimes we do it. Well, yeah. Did you have a question?
Yeah, for my son, I use the reward sticker.
Uh-huh.
So I told him every time you have pet stickers for a week, you're gonna get
A toy or?
underwear.
Oh, okay.
Spider-Man.
Okay. And has that been working?
Mama, yes, I don't want any reward. Okay, but you still have to go to the bathroom. And it worked.
Good.
But
Okay.
that was my typical.
Typically, yeah. And that, you know, because stickers and reward, social praise and stuff might be effective for a typical child, but, you know, waiting a week and getting new underwear might not be. Yeah.
Stickers didn't even work.
Yeah.
Me too.
So, well, that leads us to our next slide, I think, if I remember, is rewards. That the item or activity has to be something that's desired by the child. So if stickers are not something that a child cares about, then stickers aren't the thing you want to use. Okay? So when you first start, the best thing to use is some sort of tangible reinforcer, something they like to do or touch, be with, or whatever it might be, whether it's the iPad, time on the trampoline, you know, using the phone to call somebody, whatever it is, it has to be something that's reinforcing to the child. You know, what you think is pleasant and what they think is pleasant at their age and developmental stage. Thank you. I almost said setting. Stage is very different. So, you know, sometimes for some of our kids, finding a reward is really difficult. Like that girl that I said that's 13, we used to, when we started, like a year and a half ago, Barney was what she liked to watch. She loved all those singing and the Barney and stuff. So when she would go to the bathroom, walk to the bathroom was the first thing she had to do. We would put Barney videos in there, like, we're going to go to the bathroom, and you can go when you get there, then you can get your Barney video and bring it back and watch it. And now she's not like Barney anymore, and Mom has like gone bonkers having to listen to that singing Purple Dinosaur every time she asks her daughter tells her daughter to go to the bathroom or whatnot. So now she's transitioned to where she is really into all the Disney singing song stuff. So she likes like High School Musical and all that sort of stuff. So we've had to change the reward because her interests have changed. We tried a lot of different things. When she was sitting on the toilet, Barney lost its effect by the time we got to that next stage. She used to walk and get Barney, but now when we want her to sit on the toilet, she's like, it's not worth it to me. Like, I don't want to sit on that thing, and I don't care about Barney. So one of the things she really, she's not someone that has a lot of interests. So sometimes if you're working with children, or we work with children, that like there aren't a lot of things they really like, it's really hard to find something that's motivating them. And if you don't have that motivation, you're less likely to have the success, because again, that social motivator, that social being a good boy or big boy, or having, not being the stinky kid or whatever, is not rewarding enough. So you have to find an external reward to pair with that activity. So she liked a lot of sensory stuff, so we would roll up, if she was sitting on the toilet for those 3 seconds, we'd roll up a towel and she'd put it across her belly and she'd hit it, and she thought it was like the funniest thing ever, and that's what worked for her. And so it was like, you need to find something that works and something that's rewarding. It might be paying attention to what your child naturally does during, if you just left your child alone for, a few minutes, what would they do? They'd be on the TV, they'd be on the iPad. All right, well, then that might be the thing that's your reward. And it's like, but that's the thing they have all the time. What else are they going to do? And it's like, well, it might be that we have one kid where, for some other program, the iPad, he loves the iPad. So it was like, well, as a parent, I'm not willing to take the iPad away, because if so, my house is going to be a mess and I'm not going to get anything done. Like, the iPad is the babysitter sometimes. Like, it has to be, because I have 2 other kids and this kid drives me crazy. So I said, okay, well, maybe it's a specific app. Or maybe it's we put a password for YouTube. So then it was like, yeah, he still can do all these things, but he really likes the YouTube. So if we then save the YouTube and put a password, or make it hard for him to access, or turn on and off the internet for that purpose, then we have a strong reinforcer. So sometimes you have to restrict something a little bit, or find something specific within those interests to use as a reward. So sometimes you have to be creative and know that once they've had it, again, Barney's, going on 2 weeks of Barney, like, Barney's going to get old quick, right? So you get kind of tired of it, especially if they get to use it at all outside of toilet training time. Like, so we talk about the principles of like satiation and deprivation. If the more you have of something, the less you want it, or have a need for it. But if you deprive somebody of something, like if I have an ice cream in like 3 weeks, when he brings home the Moose Track ice cream, like, I'm all over it. But if I have it every night, in the big gallon after like a week or so, I'm like, I don't want it anymore, okay? So you have to use those same sort of principles. Sometimes you have to deprive your child a little bit of something in order to have a motivator or something that's reinforcing for them. So it might be like certain videos that if he likes TV, and it's like, well, he has access to all this, and it's like, well, it might be that you go out and buy 1 or 2 new videos, and you don't let him use it unless it's potty. It's only for toilet training. So that girl, like, I've been burning all these High School Musicals off of Netflix for her. And I told Mom, if I'm burning all these things, you are not allowed to let her use it unless she goes to the bathroom, because then it's not going to work anymore. And it took us forever to get her to find something new. So it should also be something that can be provided to the child immediately, like right after toileting. So it's not like, and if you go pee in the potty in 3, 4, 5 hours before bed, I'll let you do this. That it should be something likely that you can pull out right in the bathroom. That would be great. Right after the bathroom. So the more immediate it is, the more effective the reinforcer is going to be. Okay. So if it's M&Ms, if it's sticker, that is whatever, stick them in underneath the sink or whatever you need to do. Put it in the hall closet right outside of the restroom so that it's there. And again, the whole idea is to initially reward those smaller achievements and then progress to rewarding larger ones. So you're always kind of upping the ante. Like, again, we work systematically, so it's like, if we're going to work on sitting on the toilet for 3 minutes and then it's 5 minutes, that the reward then is never going to be given just after 3 minutes. Like that's no longer the criteria to receive your reward. Or, if I know you can stay dry for 40 minutes or for that 15 minutes, now I'm going to move it up to 17 minutes or something. And if at 15 minutes you had an accident, you don't get it. Like, that's just, that's the new criteria that you're pushing them to achieve. So you want to make sure you're moving slow enough or small enough so they can still be successful, because we always want to start somewhere where, again, like that I was saying, the interval should be like about half of that or a little bit more than half of it, so that that's successful. Because if not, like, then they don't get what they want, then you're kind of like, now you're starting all over again, because now they've lost all of it because they don't get the reward anymore. So you want to start.
Let's say if you restrict it and you say, okay, every time they initiate now, they're going to get this special app.
Mm-hmm.
So would you restrict it to they can only use it when they're in the restroom, or would you let them walk out of the restroom and use it like 5 minutes? Or?
Yeah, I usually right afterwards let them use it. If you're already working on a schedule, it means they're already tolerant. The time where we generally let them do all that fun stuff on the toilet is like at the beginning where they're having a hard time just sitting.
He just goes and then he can,
right.
He's quick.
So
then you say like, okay, now you can use it 5 minutes.
we usually do, I recommend like usually doing it, if he goes, initiates on his own, he can have it, and when he's kept dry, he can have it.
Oh, okay. But then does that diminish
The reward?
Yeah, the reward.
Not necessarily. I mean, it depends how long you let them have. If it's like you get to watch the 2-hour High School Musical, she only gets to watch like 5 to 10 minutes. If she had a bowel movement on the toilet one time, we let her watch like half an hour of it. Like, we were like, whoa, because she did way more than we expected her to. But she really got it for 5. She got the first High School Musical for 5 minutes if she went to the bathroom when we brought her, and then when she pooped, she got it for a half hour. So it might be having it just for a short amount of time, so then they don't become exhausted of it. Yeah. One of the methods that we recommend, which is more of a structured method. There are different, we talk about modeling, to use in vivo modeling to let your child watch you, or when it gets time to use the public restroom or stand to pee, that they see dad pee, whatever it might be, to allow them to observe what's going on. There are also like books and videos and stuff like that model what goes on in the restroom, those sorts of things. And then using peers or siblings, and that's just making children aware, look what daddy does, or we don't pull our pants over our bum, that kind of thing. Or so using those other people in their lives or materials to model for them the expectation. Again, that whole, when we talked about concrete, operational, and abstraction, sometimes it being in a book is still kind of an abstract concept, but actually seeing somebody else doing it live is more a solidifier of what's expected for them. So the basic toilet training rules is that if your child goes to the bathroom, they get the reward. And if they don't go to the bathroom, they don't get the reward. So that's kind of going into this basic method. We're going to show you this interval method. That's kind of the whole process, is that, again, children often aren't motivated to go to the bathroom just to go to the bathroom. It's something that all of us, whether you remember it or not, probably never just took yourself to the bathroom, that somebody had to encourage you to do it, reward you to do it, even if it was calling you a good girl, giving you a sticker, giving you pink, pretty princess panties, whatever it might have been. There was some sort of motivation that went into teaching you that. We want to use the rewards to increase the behavior that we're looking at, which is eliminating in the toilet. Okay. So the intensive training model, that's an interval-based model, that they say generally to start on the first day with about 15-minute intervals. That means you're going to be bringing your child to the bathroom about every 15 minutes, so it is an intensive approach. Sometimes it doesn't have to be an all-day approach. It could be like every day after school for a week we're going to do this. Does anybody have like in-home programming services or whatever? You do? Okay. Woohoo! So this is something that it might say, when you start this is all they're going to do during their session. They might put aside the other goals that they're working on in order to really intensely focus on this. Sometimes with those in-home programs, if you have your authorization is written in a monthly contract instead of a weekly contract, sometimes you might shift and ask your provider to intensely provide services for the 2 weeks rather than the whole month so that you can have their support there. Does that make sense? So if you usually get like 6 hours a week, or 24 hours a month, you might say, we want, to use like 12 hours a week these first 2 weeks of toilet training, so we have somebody who could sit here and help us, during the intensive 2 weeks and then not have as much therapy for the, go ahead.
Is this for initial beginning of toilet training? Because
It's
if you have a child that's say 80% successful, 90, this is gonna be hard.
No, this isn't the model we would recommend if
Okay,
they're,
so-
just like we wouldn't tell her to start bringing her child again on an interval schedule.
Okay.
But is this not something any of you need? Because if not, I won't go over it. Okay, because if so, then we could just kind of troubleshoot some stuff. Okay, so it says as soon as the child wakes up, but whether it's as soon as they get home from school, whatever it might be, we do recommend that you put them in underwear and take them again to the restroom every 15 minutes. Place them in easy-to-wear bottoms. If there is concerns about accidents, again, you can put the pull-up over or the plastic underwear over top of them. And we tell you to set the timer to bring them every 15 minutes. It doesn't mean that the child has to hear the timer necessarily. Sometimes it increases their compliance because then it's just like, oh, I hear the timer. It's not just my mean mom coming to tell me it's time to go. But remember, the step that's not in there is then get them to request it. That's a recommendation. So it says, what if it's nap time, or what if they, at night they've gone to the bathroom, or anything. At any time, if they have gone to the bathroom, you should change them, and if, even if they've done a little bit and you bring them, if they do some more, you don't want to punish because they had an accident. You want to still, anytime they actually are going in the bathroom or in the toilet, to reinforce that, okay? So the general procedure during the waking hours is that they should be in underwear and taken to the bathroom at that 15-minute interval. So as they start going to the bathroom during that interval and staying dry, so the point is they have to stay dry between those 15 minutes, that's when you can move on. So if they are just, you bring them every 15 minutes and they trickle out a little bit, but then they still are trickling out during those 15 minutes they're not on the toilet, they're not yet ready to move on. So the idea is that you're getting them to be dry in between in order to determine, like, are they holding it for the 15 minutes? Not just, are they going a little bit to get the reward, but then they're still, because sometimes the kid, you bring them and they're like, you can tell like they really want to go because they want a reward, so they're like pushing out a drip or drop or something, but then throughout the interval they're still, leaking as well, or they still go. They're not yet ready to increase that schedule, okay? During this time, you also want to add, as much as possible, a lot of fluids that they can intake, because the idea is you want to create more opportunities for them to actually have to go, again, and then come in contact with that reward, because it's really the reward and coming in contact with the reward that's going to increase them, going to the bathroom, okay? It's not just because, mom thinks you're great all the time, but it's that reward usually, okay? But it says to fade your verbal prompts as soon as possible. So again, if you're needing to tell them it's time to go, as much as possible, try to switch to prompting them to tell you, even if it's sometimes you go up to them and you make the sign and then they're supposed to say potty please, or I need potty, whatever it might be, that you try to fade the use of those prompts so that, when they hear the timer, they come up and, I need potty, instead of necessarily just, that means mom's going to come and get me, okay? So if the accidents happen, take them immediately to the restroom and have them usually sit for 5 to 10 minutes. Even if they go to the restroom again at this point, not to deliver the reward. What was I going to say? So the amount of time you have your child sit during this schedule is really dependent on how, you're going to start to know your child better than I. Does it sometimes take them longer to get going? Is it like, well, if he hasn't gone in the first 2 minutes, he's never gone, that kind of thing. So you don't want to have this arbitrary number just because some arbitrary woman at some arbitrary training told you you're supposed to be 10 minutes or 5 minutes. It's really based upon, you don't want it to be punishing. So if you know that if somebody told you you're supposed to have him sit there, your ABA provider told you it's 10 minutes, and it's like, but he's never gone in 10 minutes. Whenever he goes immediately. So it's kind of like, well, then just set it at 2 to 3 minutes, and at 2 to 3 minutes, then take them off. Because if not, then it becomes punishing for them to have to sit there too long. Okay. So it says that the interval should be increased after 3 accident-free days or accident-free, times, meaning if you're not doing a whole day but you're doing an afternoon. So it generally says about 3 days that you go without accidents during that time, and then you increase it in 5 to 15 minute increments. Again, once they start kind of holding it longer, sometimes you can make larger leaps, but the idea is that you should stay small intervals and smallly progress in a small systematic way, because then you don't want him to become unsuccessful and not come in contact with that reward anymore. And then the dry pants check is the other option that is often an interval-based schedule, but instead you're rewarding them for being dry. So this is often recommended as the next stage when kids aren't, they've become used to the interval schedule, which is very common.
But you check them wherever they're at the point, right? You don't have
Yeah.
to actually go.
No.
Okay.
So
Check 'em
you
there.
just check them, yeah. So, they're on the TV, dry pants check, or is your pants wet or dry? Go, oh, they're dry, that's awesome. You get another token, or here you can call whoever, or whatever it might be. So it's not bringing them to the, it's not, it's
Well,
bring.
we do it when he sits, we just started doing he sits and then we say, oh, is it dry? Oh, good job.
Oh, good. So then he gets the concept of what dry is,
Yeah.
so to use that.
And then he poos, pees or whatever,
Wherever.
and he gets to call somebody.
Oh, good.
That's smart too, at the toilet.
At the
Oh,
toilet.
yeah.
You're
Oh, it's dry,
High
it's
five.
great.
Yeah.
High five.
But we're saying for this dry pants check, you don't
Yes.
have to bring them to the bathroom to have it, because then it just becomes, again, they've gone to the bathroom. Instead, it's wherever they are. Like, okay, you're doing whatever you're doing, that's great, but remember, if you have to go potty, and sometimes it's teaching them, you can pause the TV, you can do this, and then go, or, take your iPad with you, I don't care, just go to the bathroom kind of thing.
When I think about it, do it whenever, the
Mhm.
pants, but then Eva, what she mentions, Eva, right? I'm
Yes.
sorry. When
Making
she
them more
mentioned
aware of
at the toilet,
Praising them for staying dry, yeah.
because
Yeah.
they love praise, I know praise.
So then during the sleep time, it sounds like many of you aren't at the sleep time thing, but it is recommended that, again, you start using you continue at first to use the diapers when they're going to take a nap or go to bed. With the remaining dry, we tell parents that's kind of more of a long-term goal. And, really, we sometimes tell parents, that's far off. And, so they might need to be in a pull-up or whatever it might take a lot longer to tackle that. But, in the short term, that's not usually something that's really as disruptive to the child. It's not really bringing them negative attention unless they're having sleepovers and stuff like that. But for the most part, if they can remain dry during the day when they're outside of your home, that means they don't need assistance with toileting at school. That means you're not spending a fortune on diapers, and if you have to use one pull-up, 1 or 2 pull-ups a night is, much more preferred. But for the, bedtime wetting, the general concept is to limit the liquid intake at least an hour before bed. And make it part of your routine, even if now they're toilet trained if they are toilet trained throughout the day, he can take himself whenever he has to go. We generally say, just when you're kids, you're going on a long car ride, and it's but I don't have to. No, you go, because, you go empty it now, because I know when we are 45 minutes into it, then you might have to go. So it's the same concept. You might not feel like you have to go, but I want you to empty your bladder, because I don't want it to have anything in it when you're sleeping. So it's the same sort of concept. So we have 1 minute. So the pitfalls to avoid primarily are to move too fast. And again, that's increasing that time interval despite those accidents. that there's inconsistency across people or settings. So, it sometimes might be really hard to get your school on board, especially if it's an interval schedule. It's like, we got this many other kids and he doesn't have a one-on-one aide. Who's going to take him or who's going to do this? But it includes when you're like, with grandma, that sort of thing. So trying to be as consistent as possible. And sometimes when we do that, like really intensive toilet training, like I said, where you might have more of your in-home resource hours being used for 2 weeks of solid toilet training, you might also want to consider making, canceling some of your, like, okay, well, that might not be a good day. You don't want to start it during the holidays, or you don't want to start, you have to think of other things that are going on during that time. But the other thing is to make sure you don't give them the reward. I know sometimes it's really hard and you feel really bad for them and they try so hard to eke out something, but it didn't happen. And if you give them the reward regardless, it's not motivating them to earn it by engaging in what you want them to do. And returning to diapers and pull-ups. Again, if you really are like, well, we're going somewhere and I don't want him to, whatever, consider again putting them on top of the underwear so that is at least taken care of, okay? And I'm not going to go into the bowel movement stuff, but in terms of the additional recommendations to think about their diet, again, increasing the liquids, or if you're in bowel movement training, to think about how much fiber they're getting. Think about how many pairs of underwear you need to have lying around. If you need any visuals or anything, again, not to start toilet training at high stress times. If the holidays are a high stress time, if you've moved recently, you're expecting a new baby, if the routine's just been really out of whack lately. The average time frame for success in a toilet training program, it says 3 to 6 months, and that's for a typical kid. So if then you take the delays your child might have, that gets kind of multiplied, usually, 2 or 3 times sometimes. They say it's common for kids to wet overnight until at least 5 years old, and by the age of 6, 90% are staying dry at night. Okay.